Hi everyone, I just wanted to hop on here and provide you with a brief overview of the grant proposal that I've been working on for the last 8 weeks of the course. When the course first began, I was actually really excited that we were given the liberty to choose our own topic. So naturally, I chose a project regarding immunizations and childhood vaccination because I think this is a topic that certainly takes precedence in our public health world and is something that's very near and dear to my heart. Given the current COVID-19 pandemic, I think that there's a renewed sense of appreciation for vaccines, but unfortunately people still forget that there are obstacles in other countries that prevent children from receiving necessary vaccinations. The purpose of my program was to provide culturally relevant immunization education to the people of Equatorial Guinea to promote the uptake and acceptance of the vaccination process through the dissemination of materials by public health and medical professionals. Equatorial Guinea is both one of the smallest and least populated countries in Central Africa. The country is listed as one of the top 5 oil producers in the sub-Saharan regions and is one of the wealthiest countries in Africa. However, despite the wealth seen in this region, Equatorial Guinea ranks low on the Human Development Index. Corruption, repression, and resource mismanagement have allocated much of the country's income to a small number of elite wealthy families, creating extensive inequalities, astronomical poverty rates, and a large breach between the per capita wealth and the human development rating. Equatorial Guinea, along with the surrounding countries within Africa, have some of the lowest childhood vaccination rates in the world. Because of this, the rates of vaccine-preventable diseases plagues this region, and the fatality and health consequences have become quite severe. As of 2016, polio vaccination rates in this country were a mere 39%, and there was actually 5 cases of recorded polio confirmed in 2014. UNICEF has estimated this region to have an average vaccination rate of the 7 vaccine series of 30%. The goals of the Equatorial Guinea Vaccine Project are to 1. Increase the education and further acceptance regarding vaccines and immunization, and 2. Increase the overall rate of vaccination distribution in Equatorial Guinea, to in turn decrease the burden of infectious and vaccine-preventable diseases in the country. There are 4 primary objectives that have been identified for this program. Number 1 is to increase the overall childhood vaccine coverage in Equatorial Guinea from 30% to 50% in the 2-year time span that the project will be carried out. Number 2 is to provide the necessary infrastructure for immunization services in Equatorial Guinea that can be utilized once the project is over so that the country can reach a point of self-sufficiency of vaccine distribution. Number 3 is to increase the acceptance rate of vaccines in Equatorial Guinea by 50% compared to baseline acceptance rates, again in this 2-year time period. And lastly, the 4th primary objective is to increase the education and health literacy regarding the immunization process so that 75% of all those reached by the program are deemed knowledgeable on the subject of vaccines after the 2 years. It is with great hope that once the primary education portion of this program has been completed, a follow-up program can be implemented and further funded to break down the current physical and financial barriers in Equatorial Guinea to provide mass vaccination to this country and their children. I feel that the Equatorial Guinea Vaccine Program and I are the appropriate organization to receive this funding because of the important global infrastructure the project provides moving forward. With the appropriate funding and resources, programs like this one can occur in any country with low vaccination rates to ensure that childhood morbidity and mortality from vaccine-preventable diseases drastically decreases in the coming years. Seth Berkley once said, "Investments in immunization yield a rate of return par with educating our children, and higher than nearly any other development intervention." I feel it's our civil duty to make that investment and increase immunization rates globally. Thank you for your time, and I hope you enjoyed my grant proposal and all of my assignments.